Heartburn is a frequent companion of the third trimester of pregnancy. Heartburn is a frequent companion of the third trimester of pregnancy. More than half of pregnant women experience it. It is manifested by discomfort and, often, a burning sensation behind the sternum. Heartburn develops when acidic contents of the stomach are thrown into the esophagus, the mucous membrane of which actually receives a chemical burn with hydrochloric acid of gastric juice, which causes these sensations. During pregnancy, especially from the third trimester, very favorable conditions are created for the occurrence of heartburn. The internal volume of the abdominal cavity decreases, more and more space is occupied by the pregnant uterus, and there is less and less room for the stomach. Due to the increase in the level of progesterone, as pregnancy progresses, the evacuation of gastric contents slows down and the tone of the gastroesophageal sphincter, the circular muscle, the main purpose of which is to prevent the contents of the stomach from being thrown into the esophagus, decreases. Heartburn treatment. Fortunately, there are ways to deal with this not too dangerous, but very unpleasant condition. They can be divided into non-drug and drug. It is worth switching to medication only after all non-drug measures to relieve heartburn have been applied, if they have not brought a clear improvement. What are these measures? You need to use them simultaneously, and not in the order of writing. Keep a food diary for a week, where to write down what was eaten and when heartburn occurred. This will help you independently identify foods that are guaranteed to cause heartburn in you and, if possible, exclude them from the diet. Very often provokes heartburn fatty, spicy and fried foods. Change your diet, eat often and in small portions, eat as slowly as possible, reduce the amount of fluid you drink with meals. Do not lie down or bend over for 2 hours after eating. Maximum, you can sit back, leaning back, in an armchair or on a sofa. Raise the head of the bed 10 centimeters by placing something under the legs of the bed. If this is not possible, at least use pillows in such a way as to achieve the same effect. The upper half of your body should be elevated during sleep. Learn to sleep on the left side. Do not wear tight clothing, preferring loose. Try to avoid constipation. To stop heartburn attacks, you can use some foods. They do not help everyone, but they are all worth trying. Whole milk, in case you tolerate it, sour milk products, puddings, grated raw carrots, sunflower seeds. In case of insufficient effectiveness of the above measures, it is worth consulting a doctor for prescribing drug therapy. Some antacids are used, with preference given to those that cause the least constipation, a common side effect of this group of drugs, as well as proton pump inhibitors, the most studied in terms of safety in pregnancy.